Hello, today's class will be on approach to a child with a failure to thriving. In my last class, I have already talked on definition, classification, risk factors and etiologies. So today we'll see how you're going to approach to a child with failing to thrive, the workup in detail, and then we'll see the management. Failure to thrive, I already said this is a descriptive term for poor physical growth like weight, height, head circumference. But sometimes some medical causes can be causing the failing to thrive, so those conditions require workup and detailed management also. Before you start taking history or doing the examination, first you have to confirm the growth faltering. So for this you need to plot weight, height, head circumference in a standardized growth chart. Either use WHO or CDC chart, which I have already explained in my last class. Then second point, you look for the crossing down of centile lines. So if they cross down two major centile lines, then it can be confirmed this child is failing to thrive. Then after that you check the growth velocity over a period of time. Just a single value will not indicate this is failing to thrive. So after you do this and you are confirmed this child is failing to thrive, you have to approach to that child based on these points. So here you have to do the birth assessment, dietary assessment in detail. You have to take a detailed family history, developmental assessment, psychosocial assessment, and then medical assessment. So these are the major headlines. Then start taking the history. So when you take a history, see the onset of the growth failure, whether it is congenital or it is acquired, because this is going to give you a hint for the cause of failing to thrive. Then you take a prenatal or antenatal history. So any intrauterine conditions or exposures which is going to affect the fetus in the womb, that will be important. So some important points will be smoking, alcohol consumption in the mother, or any medication taken by the mother, and whether there was any chronic illnesses during the pregnancy time like torch infection or any maternal renal failure, rheumatic heart disease. So all these problems you have to see in detail. Then postnatally you need to see for the birth weight and the length, then whether this baby was a premature baby or a small for gestation age baby, whether any neonatal asphyxia had occurred or any kind of problems like neonatal sepsis or neonatal seizures occurred during the postnatal life. Then see for the congenital malformations or infections occurring in the newborn. Then another important is dietary or the feeding history. It's very important. So in this, start with the breastfeeding, whether it is appropriately done or not. Exclusive breastfeeding till 6 months, then continued breastfeeding till 2 years or not. If yes, then adequacy of breastfeeding, how many times, the frequency, whether this child was initially breastfed for 8 to 10 times or not, and duration of breastfeeding, this should be checked. Then if the parents are giving formula feeding, the preparation errors should be checked, because many times they don't know how to prepare the formula feeding adequately or properly. Then you check the feeding schedule of the child, the diet supplement, when it was started and what type of food was given, when was the solid food introduced and what all food were introduced, and the schedule, how many times, frequency this supplement feed was given. Then after that you check for the inappropriate feeding techniques. Many times they don't know the technique of feeding, so this you have to check. So detail about this I'll be talking when I am teaching you the dietary class. Any restriction of food which is based on the finances or religion. Sometimes there is certain religion restriction for food. Sometimes they don't have money to buy certain food. So those you have to check. Then food refusal, feeding difficulties by the child. There can be any issues like sucking, in the sucking ability, if they have a cleft lip palate, or when they are very sick or they are very hypotonic, then they might have these problems. Then any choking or regurgitation you have to check. Then lastly you have to take the caloric estimation the calorie intake estimation should be done. So here you have to calculate the calorie requirement of the child and then see whether the child is getting adequate amount of calorie or not. So in the nutrition class you will learn how to calculate these calorie values. Then you take a detailed family history. So here you need to take the parental height and growth pattern, how this parent had the growth pattern, that is important. And then consanguineous marriage was there or not, because many consanguineous marriages land up with some genetic diseases which may lead to failing to thrive. And then any chronic medical illness, disease in the family or any genetic disease in the family should be checked. And age and occupation of the parents is also important. And then whether these parents were young, so young parental age, because at young age they don't know many things. And then family size. So if there is big family size, there can be scarcity of food, especially if they are of low socioeconomic status or if they are poor. Then you do the detailed developmental assessment. This you have to do by taking a detailed history, asking questions to the mother. Each domain of the development you have to ask to the mother. And then while doing examination, again you need to assess the developmental milestone. So if there is a delayed milestones, there can be genetic causes of failing to thrive or maybe endocrine causes of failing to thrive. So in detail you have to take the developmental history. Then come to psychosocial history, which is another big risk factor for the failing to thrive. So see if there is any major events in child's life. Many major events means losing some very close person like maternal death, or sometimes change of school, change of environment. This is going to affect the child. And see family life stresses like loss of job of the parents, if the parents are divorced, death in a family or single parent family, if there is depression or domestic violence in the family, and if there is substance or physical abuse like alcohol or drug abuses are there, then the environment of the family is not good. That is going to affect the growth of the child. Another is child rearing beliefs, like sometimes poor parental skills are there, and sometimes they are vegetarians, or sometimes there is restriction of food in the religion beliefs and all. So those you need to see. Another is poverty or neglect by the parents, and certain nutrition beliefs of the family. It is same like this. So some people, they fear of obesity and then they give less food, and sometimes if there is a prolonged exclusive breastfeeding, they go on breastfeeding, they should be feeding exclusively till 6 months. Sometimes they exclusively feed for longer time, maybe 1 year or 1.5 years. That is also not correct. Or if there is early weaning, that is also not correct. And then social isolation is another psychosocial problem. Then in the medical history, see for the chronic illnesses in the child. Chronic illness like recurrent infections can be there, diarrhea, pneumonia or urinary tract infection. There can be problems of malabsorption like celiac disease, cystic fibrosis, and there can be metabolic or endocrine diseases. So this disease you have to check. Now let's see the red flag signs, which is going to suggest the child is having medical cause which is leading to failing to thrive. So those signs are global delayed milestones, family history of unexplained sibling death or abortions, failure to show catch-up growth after calorie deficit has been corrected, if there is dysmorphic faces or syndromic faces and skeletal deformities, and if the child is having recurrent seizures, if there is jaundice, lymphadenopathy, hepatosplenomegaly, clubbing or cyanosis, if there is non-diarrheal dehydration or recurrent infection or skin lesions. So all these signs will tell you this child has some medical illnesses or medical problems. Then move on to examination. You have to start with the general examination. So here, very important in general examination is you have to do the complete and detailed anthropometry measurements, that is especially the weight, height and head circumference. So serially these values are measured in different occasions. Single observation is not confirmatory for failing to thrive. So you need to take a serial measurement, calling them after a week or maybe a month, so that we have to follow up. And then interpret these things on age and gender specific population reference growth charts. Those are the standardized growth charts which is available by WHO or CDC. In the developing countries, WHO is followed, and developed countries, younger children, WHO growth chart, and then for bigger children they use CDC chart. And then separate charts for preterm babies should be followed, that is a Fenton growth chart till infancy. Then gradually you will replace with the WHO growth standards. Then check the vital signs, where you need to check temperature, pulse rate, respiratory rate, blood pressure, and then the saturation you have to check. Then do the head to toe examination. When you are doing the head to toe examination, different clues you can get for genetic diseases, for severe malnutrition, for physical abuse or systemic diseases. So for these clues you have to check from head to toe. Let's see what are the clues. So number 1, clues to genetic disease. There can be dysmorphic faces. It will be chromosomal or metabolic disorders if there is dysmorphic phases. Neurocutaneous markers for the neurofibromatosis or neurocutaneous diseases. Microcephaly for many cerebral palsy and many other genetic diseases. Delayed closure of fontanelle, cataract, delayed milestones, expressionless face and hypotonic or hypotonia. Then oropharyngeal lesions like caries, tongue enlargement, mandibular hypoplasia, tonsillar hypertrophy, defects in the soft and hard palate. So all these will indicate genetic disease. Clue to severe malnutrition are poor growth failure to meet expected weight height for age. Then there can be physical signs like sparse hair, alopecia, dermatitis, edema, loss of buccal fat, hair and skin changes, reduced subcutaneous fat or muscles. Then there can be cachexia or thin extremities and prominent ribs and wasted buttocks. There can be moon face in case of kwashiorkor and wasted face in case of marasmus. Skin and mucous membrane changes like pallor, scale, and then scaling skins. Skin changes in kwashiorkor. And there can be signs of iron deficiency anemia like irritability or spoon-shaped nails. And then there can be vitamin deficiency signs like chelosis, cheilitis, and then smooth tongue. All these features can be there. And delayed tooth eruption can be another point for or clue for the severe malnutrition. Third is physical abuse. The clues for physical abuse will be fractures, bruises or hematomas present in different parts of the body. And clues to systemic disease are clubbing, pallor, cyanosis, lymphadenopathy, edema, dehydration, thyroid enlargement or thyroid diseases. Then you go to detailed systemic examination, where you'll do the respiratory system examination, look for signs of pneumonia and signs of other respiratory diseases. In the abdomen, you can look for abdominal distension, hepatosplenomegaly, which are going to indicate you the chronic disease of the abdomen. And cardiovascular system, you have to check for the murmurs, detect for the congenital heart diseases. And nervous system examination, you do the developmental assessment bedside and also do the detailed neurological examination to see for any problems. And check the genitourinary system, musculoskeletal system, where you are going to see for the bony deformities, craniotapes, beading of the ribs and scoliosis, bowing of the legs or distal radius and ulna, enlargement of the wrist. So all these are features of rickets. So, and even in the scurvy you can get some bony changes. So musculoskeletal examination is also important. Now let's move on to the workup or what lab investigation you'll do. As we said, failure to thrive is a clinical diagnosis and most children do not need any investigations because main cause will be nutritional or psychosocial causes. So usually the investigations are not required. But in case of red flag sign which is indicating organic or medical causes, then in that condition some investigations will be needed. So the lab investigation you are going to do is, first you just start with the routine check. So simple routine test will be complete blood count with the peripheral blood smear. renal function test, urea, creatinine, electrolyte levels you can see, liver function test you can see in detail, random blood sugar you can check, urine analysis you'll do, urine routine and then culture sensitivity examination you can do, stool examination you can do, stool routine microscopic examination, and even estimate the stool fat for malabsorption syndromes. And then ultimately you might have to go for TB workup. So this will be depending upon the history what it is telling you. Only in special conditions you require these tests. So sweat chloride test for cystic fibrosis, for celiac disease, IgA antibody you can do, bone age you can see for the endocrine short stages, and then endocrine studies may be required, and imaging MRI or CT scan may be needed in some conditions, metabolic screen if you suspect inborn error of metabolisms, or karyotyping in cases of chromosomal disorders may be required, but these tests are very rarely required. Now for management, when do you hospitalize a child? So indication of hospitalization in failing to thrive, number 1 is if you require workup for severe malnutrition. Number 2, as a part of diagnostic workup if you are suspecting organic or medical causes. And number 3, if the child is not responding to your initial outpatient management. Number 4, if there is a parental neglect, abuse or maltreatment suspected by you. So in those cases also you have to admit the child. And the treatment is multidisciplinary and stepwise approach is very effective. So gradually you need to include different departments. So main cause can be dietary cause. So here nutritional rehabilitation you have to do. So here frequent small energy dense meals are given to the child, and you try to correct the nutritional deficits like vitamins and minerals. Then second point, which is very important, is parental education and counseling regarding the nutritional requirement and then the correct feeding technique for the child. And then you go on with the specific therapy where antibiotic to primary infection can be given, some replacement therapy if there is a hormonal deficiencies, some transplant may be required, and the avoidance of the offending agent is important. So try to treat that cause. And then some cases require intravenous immunoglobulin, steroid or some chemotherapy treatment. Okay, I'll just show you the simplified approach how to approach a failing to thrive child. Suppose a child comes with a failing to thrive, then you take a detailed history including the psychosocial review also. That is very important. Many times you forget this part. So since this is one of the very major cause, you have to include the psychosocial history. Then thorough physical examination is done where anthropometry is very, very important. Then you admit the child to the hospital along with the primary caregiver or mother. Then do initial investigations which include CBC, ESR, urine analysis or urine culture, stool test to see ova cyst parasites, and then do the screening for tuberculosis, screening for HIV. Those are two common infections occurring leading to failing to thrive. So after that, trial of nutritional therapy should be done with a calorie dense diet to every child. Then see whether there is a good weight gain in the hospital in 4 to 5 days or not with your nutritional supplement. If there is good gain in the weight, then there is no organic disease. Then you consider psychosocial problem and try to intervene in that line. Then you do the regular follow-up of this child with growth monitoring every month. Then suppose the feeding, after you start with the feeding, there is no weight gain or either poor or no weight gain in 4 to 5 days in the hospital, then you reassess the child, do the further physical examination, and then you try to find out or seek for the medical problem or any organic disease is there or not. Then if you suspect the organic disease, accordingly you have to investigate, inviting appropriate specialists for the disease specific treatment. So accordingly you can refer the child to the specialists. Okay, now I'll just show you some case scenarios. Case 1, I'm just showing a 2-month-old child presents to you with failing to thrive, and there are no other symptoms beside this failing to thrive. That is, height, weight is affected but no other clinical systemic symptoms. And when you go to examine the child is always hungry and crying. And then in the history you saw this mother is giving dilute cow's milk, and physical examination is showing everything is normal except the anthropometry. So in this scenario, diagnosis will possibly be malnutrition. So this child will not require any further investigations. You'll just try to correct the feeding and then teach the parents how you are going to rehabilitate the child. Okay, scenario 2, suppose a 2-month-old child comes with a failing to thrive, but this child has a repeated breathlessness and tachypnea, and when you take a history, mother also says this child passes greasy stools. So this is leading you or hinting you towards cystic fibrosis. So then your examination should be towards cystic fibrosis and do the specific test for cystic fibrosis. That is that starting screening with the sweat chloride test, then you do further genetic studies. Scenario 3, a 4-month-old child presents with a failing to thrive again, but this child has abdominal distension for around 2 months. Then when you do a physical examination, you find this child is ill looking and is pale also, febrile. There is lymphadenopathy, hepatosplenomegaly, but other systems like respiratory, cardiovascular is normal. So in this scenario, the possible causes can be tuberculosis, Kala Azar, histiocytosis or leukemia. So infectious cause, infective cause and malignancy. So depending upon this, in this case you have to proceed in that way. You have to choose specific investigations. Then case scenario 4, a 5-month-old infant again comes to you with failing to thrive, and then you found this child has a delayed milestone. In your physical examination, this child is icterus, having jaundice, has features of rickets, there is abdominal distension, there is firm enlarged liver and spleen, and there is hepatic and renal progressive disorder. So gradually progressive hepatic renal function is deteriorating. So in this type of scenario, your possible cause will be inborn error of metabolism. So possibly this is a case of tyrosinosis. So if you suspect inborn error of metabolism, so accordingly you have to screen for the inborn error of metabolism. You get a screening test, you go with that test. Okay, thank you. So I hope this class was helpful to you. If you find my class useful and helpful, just like, subscribe and share. Thank you.